Hi there, welcome to my YouTube channel. We are starting out the new year with a massive norovirus outbreak in the United States. So I'm here today with 5 tips on how you can prevent norovirus infection and hopefully avoid this outbreak. I'm Dr. Katrina Coulter. I'm an infectious disease specialist and I make educational health videos. So today I have these 5 tips to help you prevent norovirus. But first, a little norovirus 101. So norovirus, also known as Norwalk virus, is, like it sounds, a virus. So antibiotics do not work on it. So don't go to your doctor asking for antibiotics because they will be of no benefit to you. Norovirus is the most common cause of acute gastroenteritis worldwide. So that means vomiting and diarrhea virus. And norovirus is usually more of an upper gastrointestinal infection where we see more vomiting than diarrhea, but you can definitely have both. So it will come on as an acute onset, very abrupt abdominal pain and cramping with nausea, vomiting, and sometimes diarrhea, but the diarrhea doesn't have to be there. If you do have diarrhea, it'll be non-bloody and usually about 4 to 8 stools in a 24-hour period. Some people also will have headache or muscle aches with it. And in very severe cases, we have seen hepatitis or inflammation of the liver in children. We've seen peritonitis, inflammation of the peritoneum, which is the abdominal cavity. And it can be fatal in certain people, immunocompromised and elderly. However, most cases are self-limiting, meaning it just goes away on its own. So there's a whole range of presentation that you may see with norovirus. Norovirus is highly contagious. It takes very little of the virus to infect somebody. And symptoms usually occur about 12 to 48 hours after you've been exposed. So this hits quick. You're gonna know if you had it or not. The problem is that the norovirus can be shed before symptoms occur. It can start shedding about 25 hours after exposure. So you may not have symptoms yet, but you may be shedding the virus. It usually is self-limited and will last anywhere between 12 and 72 hours. So about a day, and most people are going to be better. But again, you can still shed virus for up to 3 days after your symptoms resolve. And this is the problem. This is why we see these huge outbreaks. And we see these in restaurants, healthcare settings, cruise ships, schools, situations where large groups of people congregate like church. So if you are a healthcare worker or you are a food service worker and you are watching this and you have had norovirus or you get norovirus, you should not be returning to work as soon as symptoms resolve. You need to wait 2 to 3 days before going back to work because you could still be shedding the virus. It is transmitted by fecal oral transmission. It can also be transmitted through vomit and saliva and contaminated surfaces. It can live on surfaces for 5 to 12 days. That's a long time. And so we'll get into what to do about that. You can also find this virus in contaminated food. And that's where when we have food service workers going back too soon, food can become contaminated and the outbreak can be perpetuated. So how do we diagnose it? There is a stool PCR test, so we have to get a stool sample. Most people will not end up getting this test because most people will not present to a healthcare setting. Usually by the time it occurs to them to go, symptoms have already resolved. Again, symptoms are going to last about 12 to 72 hours. In somebody who is immunocompromised, it may last much longer and you may shed the virus much longer if you are immunocompromised. So just keep that in mind. In my clinical practice, I found that usually by the time we get the test result, the symptoms are already gone. But it does help us for outbreak knowledge if we know that you've had it, because then we can advise you on when to go back to work. You should be talking to your healthcare provider about when to go back to work. So what do you do if you get it? You need to stay hydrated. Hydrate. So lots of fluids, things like bone broth or electrolyte drinks can help you out. Some people will need to go to a healthcare setting for IV fluids. Unfortunately, right now in the United States, we are still recovering from an IV fluid shortage due to some hurricanes. And so not all healthcare settings are going to have IV fluids readily available. And so if you can manage it with electrolyte drinks and other supportive care at home, get on it. There's also foods you could avoid to minimize symptoms, and those are going to be dairy and high-fat foods because your inflamed intestines are not going to tolerate those kinds of foods well. There's also something called a BRAT diet that everyone should know about anyway. This is B-R-A-T, BRAT diet, and this is helpful for all types of diarrhea. So it's bananas, rice, applesauce, and toast. And these are foods that contain soluble fiber and help bulk up the stool, slow the transit through the GI tract, and just help in general with diarrhea. You should probably be avoiding anti-motility agents or things like Imodium because you want this to run on through. All right, so let's get into 5 tips on how to prevent the norovirus. I really hope that you can be the one to prevent this. So tip number 1, do not use alcohol-based hand sanitizers if you can avoid it. So these do have very little activity against norovirus, and we're probably over-dependent on them. They work in a pinch when there's no soap and water available, but the preferred method is soap and water for hand hygiene. Right now is the time to be obsessive about washing your hands with soap and water. Before you put anything in your mouth, before you touch your face, anytime you're in a group setting, anytime you touch a high-touch surface, wash your hands with soap and water. Tip number 2 is clean those high-touch surfaces. So if you're sharing surfaces at work, like keyboards, countertops, mouses, kitchens, things like that, all those areas should be cleaned regularly with a bleach-containing solution, and that solution really needs to sit on those surfaces for 5 minutes to be as effective as possible. Think of all these surfaces that need to be wiped down. So these are light switches, doorknobs, cabinet handles, countertops, your cell phone, remote controls, things like that. Clean all of these with bleach because these are fomites or things that can contain this virus and hold on to it in an active form for 5 to 12 days. So wipe everything down, have a bleach party. Tip number 3. This one is near and dear to my heart. Take care of your microbiome. Your microbiome is the trillions of bacteria and fungus that live in your gastrointestinal tract. The more you take care of it, the more it is prepared when assaults come from things like norovirus. So how do you take care of it? You need to quit eating ultra-processed foods. They are terrible for your microbiome. I have an entire video on that you should check out. There's also foods that you should have in your diet that are great for your microbiome, and they have specific antiviral properties. Things like garlic and pepper, and there are a ton of other spices like sage and oregano, etc. I have specific videos on garlic and pepper and all the massive health benefits and why you should be eating those anyway. So go check out those videos, like, subscribe, ring the little bell. I'm also creating a series that will be coming up soon all about your microbiome and all its effects on our health. So go ahead and hit that little bell so you don't miss out on those. But take care of your microbiome. One more tip on that is certain medications are not good for your microbiome. And one of those medications that can predispose you to getting norovirus is a proton pump inhibitor. This is a common antacid medication that many people are on. It's available as a prescription and over the counter. And we as providers often start people on this and forget to stop people from taking this. So people kind of get started and they take it for too long. So ask your health care provider if you still need this medicine, and if you don't, get off of it because you need that acid in your stomach to help get rid of these foreign invaders that don't belong there. So that brings us up to tip number 4. Tip number 4 is avoid sharing food and personal items that go on the face. So I love to eat with people. I love to eat family style at a restaurant. I love to have potlucks. Breaking bread is my language of love. I just really enjoy that. But right now is not the time to do that with all these outbreaks going on. So not the time to have your potluck at work or in your recreational activities, and maybe consider ordering your own dishes, not sharing off of each other's plates at restaurants. And also maybe consider now is the time to cook at home and not be going out to restaurants, because those food service workers may be coming back a little bit too early, especially if they don't realize that that's what they have is norovirus. And then tip number 5 is prepare your food appropriately. So you can get norovirus from foods, especially from green leafy vegetables, from raw shellfish like oysters. So you want to cook those thoroughly right now. You want to wash your vegetables really well. And please know that steaming and freezing does not kill norovirus. You have to cook it all the way through. So make sure you are preparing your food appropriately. And hopefully those 5 tips can help you avoid this nasty little virus. So go wash your hands right now with soap and water. Go decontaminate all those high-touch shared surfaces. Hit like or subscribe. Share this with somebody you know that can benefit, and hopefully you can be the one to avoid norovirus. I'll see you on the next video.